Welcome to Health Career Foundations. My name is Lisa Coyne, and I'll be sharing with you today all about our program. Beth O'Donnell is another instructor here too, and she will be monitoring the chat. Please type in any questions you might have, and we'll be sure to answer them. Here are our instructors. This is me, Lisa Coyne, and my background is in medical laboratory science. Haley Kane is an occupational therapist. Leslie Kirschenbauer is another occupational therapist. Beth O'Donnell is a physical therapist. And Yvonne Alice holds a doctorate in health administration and came to KCTC from the collegiate world. Here are some highlights of what students can look forward to when they experience our program. We start by laying a good foundation with anatomy, physiology, and medical terminology. Along the way, we add exposures to many different health career paths and the skills and procedures that those health professionals use to take care of patients and their families. There is direct and indirect articulated college credit available. We'll talk more about that on a future slide. And we also offer first aid certification. Students who successfully complete our program can go on to senior year program that follows a certification or a college-bound track. Some of the certifications we offer in that second year are pharmacy tech, nurse tech, patient care tech, sometimes called PCT, or CNA, certified nurse assistant, medical assisting, EMT, and we also have a sports medicine track that covers all the therapy careers in healthcare, and a biomedical services program that has a research and pre-med focus with additional college credits. Here you'll see our curriculum for first and second semester. During the first semester, we cover a majority of the basic introductory material, such as anatomy and physiology, medical terminology, safety, and infection control. During non-COVID years, we add visits to assisted living facilities, performing blood pressure checks at the YMCA during Heart Health Month in February. We have visits from lots of healthcare professionals like registered nurses, medical residents, and physician's assistants, just to name a few. And just this year, students were able to watch a live open heart surgery from a hospital out in Chicago in real time and ask questions of the surgeons, nurses, and surgical techs in the operating room. It made a great impression and really inspired them. All of this helps to give the students a firm foundation and sets the stage for second semester, which is where the application of all that knowledge comes into play. We encourage students to really be in touch with areas they like and ones that they don't. And this is really a time to figure out if the content and the pace is right for them. And it's okay too if students realize that healthcare might not be the best fit for them, and now they know and can explore other options. And you can kind of see some pictures here of students doing suturing and splinting and bone dissection. During second semester, we finish anatomy and physiology and med term, and then we begin using all that information to figure out how to diagnose, treat, and take care of patients. We give them lots and lots of practice understanding what keeps people healthy and what conditions make them sick. We use clinical case studies to help them play detective and solve the mystery. They also learn about how to pay for healthcare and how to document everything that happens. And at the end of each semester, we ask healthcare professionals from the community to come in and evaluate students' performances. They offer a really valuable level of experience in defending their learning and career goals. And then there's more pictures here of walking through the heart modeling, heart dissecting. So that's those. And then here are just a few of the many careers that students can pursue with additional education after they graduate from their home school. You can see some of the students working with some of the activities we do that really reflect those careers on the left. Surgical trainers, they're practicing performing laparoscopic techniques, suturing, testing, listening to someone swallow. All those are all great activities that they've learned along the way. Now you can see the times of our 3 sessions during the course of the day. We start as early as 6:55 a.m. and then 12 p.m. is our last third session. And we have one session in between, a 9:15 a.m. session. We do have a dress code, and the students are allowed to practice skills in the lab only if they're in uniform. And we try really hard to mirror what business and industry demands as far as attendance and work behaviors. And you can probably see so far, our class is very fast paced. There's usually homework every week, and we have a really good blend of academic rigor, hands-on skills, project-based learning, and more traditional types of assessments. You'll have to check with your home school for the high school credits they will award students for attending KCTC. Every school is different. We do offer a 3-credit dual enrollment course from Ferris State University, and it's a medical terminology course, and it will transfer to other colleges as well. Even if you don't go to Ferris, any of the other ones locally, it will transfer to. Students will have additional homework, medical terms, and case studies that they will need to work through above and beyond what we do in foundations. And if students didn't take that college course, they can articulate credit for some other health career courses at local colleges if they average an 84% or better in our class. For certifications, we offer a certification in the American Heart Association's first aid program. And then we also offer certificates in Stop the Bleed and compression only CPR. HOSA right here is a national leadership organization, and students compete in over 50 different events alongside other health career students in Michigan on a regional, state, and then a national level as well. They come away with so much experience and confidence in chasing their dreams, and it's really a joy to watch them compete and celebrate. Here we'll check out one of our learning labs. We have 3 of them. They're set up for both inpatient and outpatient design. So students get to go here for at least every day. And then here's one of our classrooms. This is Mrs. Kirschenbauer's classroom. They're set up in pods right now with COVID. And here are some students learning a living, and you can kind of see more activities that we expose them to throughout the year. They really enjoy sharing what they know. If you wish to enroll, there's a lot of different ways to do it. You can contact your school counselor. You can call the development facilitator's office right here, or you can visit this website as well. And we'll end with a couple of testimonials of students who really wanted to share what they're learning. The first one is from Jeff. He's a senior. It's his first year at KCTC, and we'll listen to what he has to say.
Hi, I'm Jeff Slay-Oxis. I'm 17 years old. I'm a senior at West Michigan Academy of Environmental Science. My first thoughts here coming to KCTC, I didn't know what to expect, honestly. I knew it was a health career class, and I knew I wanted to be in health careers, so I just gave it a shot. So when I first came here, I tried to scope everybody out, and then I started liking it. Thanks to Ms. Coyne, everything was really easy. She taught me different things. She helped me open my creativity. She helped me come out and express who I truly am. And so my future goals would be being a physician assistant, going to school for it. I want to have my own business. I want to build buildings. I want to do everything. I want to help somebody. I want to do stuff with mental health. And anyone coming to KCTC, I recommend it 100%. Respectfully, you should come. Thank you. Hi.
Oh, that's Jeff. And then now we'll hear from Karina. I'm going to stop sharing because you're going to hear her live.
Hi. Okay. My name's Karina Landero, and I'm part of the Health Career Foundations class here. My teacher is Miss O'Donnell. I go to Lee High School, which is a relatively small school. We have around 1,000 students from 6th to 12th grade, so a really small school district as well. I chose KCTC because I was really on the fence about my future career path. I was debating between law or some going into somewhere medical. And then I ended up getting a program visit here for a different program, but I ended up transferring to Health Career Foundations, and I'm really happy with my decision. The thing I like best about attending KCTC probably would be the people here. There's a lot of determined and passionate people here who aspire to be a whole bunch of different things, and I love learning about different people. I love learning about like their dreams, and so this is the perfect place to just not only learn about yourself but other people. Probably the most surprising thing about attending KCTC is how much I've grown as like a confident student, but also just as well as my knowledge about the health field. If you come here, regardless of whatever program you're in, you will learn a lot. This is a really career-based, employability place, and I love the opportunity that it gives here. So, any advice that I would give a student would probably just be come here ready to learn, come here ready to adapt, to change a little bit. And it's all good change that comes. I feel that I've grown a lot as a student. I feel like that this has prepared me for the workforce and post-secondary education as well. So just be ready to grow, just be ready to learn. And as for like helping me navigate my future career goals, I was really indecisive before. I didn't have that much knowledge about healthcare or the specific roles in it either. But now that I've taken the course, I have a pretty definite plan. Like I said, I came in here thinking maybe I'll do something in law, and I'm enrolling in the EMT course next year. So it just kind of went like a full 180 with where I was going, and I wouldn't have it any other way. Like I'm really happy with what I've learned about myself and healthcare so far in this class. So yeah.
Let's do that. Thank you, Karina. Um, we can open it up for questions now. Do any of you have any questions for us?
I'm curious if you guys are attending only this session, or if you've attended another or plan to attend another tonight. You guys are muted if you're talking. So, Lamar, I don't want to say your name wrong, and I'm struggling. Lamariana, is that how you say your name? Can you unmute? I know you and I have been chatting, so um, when people are interested in veterinary medicine, because we don't have a direct link to veterinary medicine right now, we look for what meets some of those needs that are common in veterinary medicine. And I work at the zoo on the weekends right now. I will tell you the vet techs that I've worked with in the area that I'm at right now. Last weekend had to do ultrasound. I had to help with x-rays and blood draws on an animal. So diagnostics is a good exposure to all of those different types of treatments that you would be doing as a veterinary technician. Okay, I see that your mic doesn't work. Also, you come out of there with a certification as a phlebotomist, and since you're a senior, I would recommend if you can jump on that one for the final go around to do that one. The other one that is a great option is pharmacy tech, because all the medications, a lot of them cross over from the human world to the animal world. But I know you're interested in dual enrollment, and that one does not offer dual enrollment, but it does offer certification. So see if you can jump on one of those for the final go around tonight. Amber, do you have any questions too? Okay. wondering if my daughter's planning on going into nursing, if she should do the health foundations class first and then the CNA. Yes, 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 yes. The second year programs assume that you have the basic anatomy and physiology and medical terminology and all of those things down, and then they build upon that. So foundations really truly is your foundational layer for the other programs to build upon. So it will make it much less stressful for her senior year because they're assuming you know that information.
Okay, and so you would typically do this class as a junior and then the other as a senior?
Yep. Yeah.
Okay.
Yeah.
Great, thanks.
And also don't be surprised if your daughter comes in thinking she knows what course and then changes course as she learns about different career paths. So we help them kind of discern what their next step might be if that changes throughout the course of the year.
Okay.
Yeah, to add on, my mom can personally attest that I basically would come home every week being like, oh my God, like I learned about this today. This seems so cool. So, yeah, it's a really exciting course. It will give your daughter a lot of exposure to different fields and a lot more intricacies about nursing, because I personally didn't have a good understanding of nursing until I came to this program. And I have a lot of friends who are really excited to do the CNA course next year. And a lot of them want to go into like neonatal nursing and stuff like that, just really cool stuff. So that's the perfect route to go, is foundations and then nursing for her. Yeah.
Any other questions or wonderings that we can help you with in your decision or thought process? We do have, Amber, a video that will be going up on the website. Do you know when that's going to be going up?
I'm not sure.
So they'll have these recorded, and then they also made another video about the program that if your daughter isn't able to attend tonight, you can go back and look at the techcenter.org and check out the different programs with her.
Perfect. I think I'll do that with her. She's not around tonight and she's a freshman. So we have a little bit of what to figure this out, but I just kind of wanted to know what the process was.
Sure. Yep.
So the other thing for freshmen, it's great you have time. I would recommend as a sophomore, feel free to add Mrs. Coyne if you have any thoughts as well, for her to do an in-person tour if they're back doing those. Mm-hmm. You can really see the different courses in the health hall. And then that kind of bumps them, at least in a pre-COVID year, it bumps them up on the registration if they've attended an in-person tour. Because typically foundations have wait lists. So you don't want her to wait, like as soon as registration opens for KCTC, her sophomore year for her junior year, you want her right away to express that she wants to be in foundations. Don't wait till August.
Okay, good to know.
Okay. Anything else that we can help either of you with?
No, I think I have all my questions answered. Thank you.
All right. Well, thank you very, very much.
Thank you for coming and good luck with your decision.
Thanks.